Welcome to Educated, Empowered, and Enthused. My name is Dr. Megan Kaylee McPhee-McGlone. I am a physical therapist, fitness instructor, wicked fierce mental health advocate, and the founder and owner of Lovely Bones, your one-stop shop for the holistic health and fitness services that you so deserve. Wow, nailed it. How we all doing today? How we doing? I'm having fun on this podcast. We're getting into it. The new setup, it's going well, and I'm feeling really good about the reception of the new and improved education. I want these all to be feeling like a conversation between two friends, a conversation between a physical therapist that really cares about you, and I want it to feel cozy and laid back, but I also want to give you the hard truths and give you the information that is hopefully going to be really applicable to your life and, integratable in a meaningful way. I can yap all day, but I'm always going to take it home, and I'm always going to leave you with something that you can apply, a tool to take home for your toolbox, if you will. Today, I want to go over a topic that's been a really frequently asked question. What is the difference between rehab and training? And specifically, really, we're kind of talking about strength training, because there's a ton of different treatments you can get in physical therapy, and there's a ton of different things you can do in terms of training. You could be training for speed, agility, and power. There are, multiple things within this umbrella, but let's focus on, really strength training. Rehab exercises that are meant to activate your muscles on some level versus strength training exercises that somebody might think about doing in the gym when you're just trying to stay healthy and well. This is a hot topic in the profession. It gets at what a physical therapist's scope of practice is, and it's also going to give you some applicable tips in terms of when to go see a physical therapist. Where does the line fall between an exercise that is just for acute rehab, acute recovery from injury? Maybe you think about resistance bands. I think that's what people associate with physical therapy, versus what is an exercise that is appropriate for training in your everyday life to stay healthy and well. People often judge and they'll say, oh, well, that's a PT exercise, or that's not hard enough. You want to say that you're doing strength training, you should be doing XYZ instead. This is a very hot topic, and I want to dispel any myths today and hopefully give you a perspective that will be helpful to apply to your life in terms of if you run up against periods of time where what was appropriate for you in terms of your training may no longer be appropriate, whether it's different stressful life circumstances. You may not get formally injured, but maybe you're sick or you're not feeling well. I'm hoping that this blows your mind a little bit. What is the difference between training versus rehab? Why is it important to know this? It's important to know this because I want you to be able to, whether you're acutely injured or not, understand what is going to move the needle forward for you and understand what is appropriate for you right now. Why is it important to know the difference between those two things? Again, I hope it's really helpful and applicable to you if you ever hit a season in your life where hopefully, knock on wood, maybe you're not acutely injured, but you might hit a season of your life where that regular training session for you that once was very easy might not be so easy anymore. Maybe you are a really busy parent. Maybe you have some other stressful life circumstances going on. Maybe you have a bout of illness, whatever it may be. I want to help you reframe training and what is appropriate for you at any given time. And it's not Physical Therapy Month, but it is March while we're recording this. It is Women's History Month, and I don't know if you know this, but if you don't know, now you know. Women founded this profession. The founding mothers, salute, of physical therapy are absolutely incredible, and I'm sure I'll do a little lecture on that someday. But my point being, it's also important to understand the distinction because it's going to help you understand what physical therapy is, what we truly can do and offer, and it'll give you a little insight into the puzzles that I put together for individuals every day and how I individualize the training or the treatment that you need. And I think it's safe to say that a lot of people, unless you have a physical therapist maybe in your circle of friends, or you feel like you're really knowledgeable, maybe you've gone through a course of physical therapy with a PT who you really respected and learned a lot from, you probably associate our profession with little resistance bands, like things that are, doing your shoulder exercises and the pulleys in the door and this kind of, for lack of a less charged word, this like low level stuff. And to be absolutely clear as well, there are tons of different subsets of the field of PT. It is vast. What I want to kind of inform you a little bit more on and dispel some myths for are those outpatient folks. And I really want to dispel the fact that PT is just that. It's just the low level, the teeny little clamshells on the bed, and then you're out of there and you're good to go. Sometimes that's appropriate for people and you stop there and that is what it is, but the vast majority of folks need to be appropriately readied for the tasks of their everyday life. I think last podcast, and I put out a clip that got quite a few views. I said something like one of the greatest failures of healthcare and fitness professionals alike is not giving you something that you can really own, that is really realistic and sustainable for you. In the same vein, and it really relates to that exact same concept, I think it's fair to say that one of the biggest failures of a physical therapist, regardless of the really well-meaning intent, would be not giving you enough to make you feel that you are truly ready to take on the tasks that you have to go back to when you are recovered from your injury. If you are a mechanic, for example, I have a whole example written down here for my mechanic homies. I had a mechanic that I treated at Bay State Physical Therapy in Arlington years ago. Shout out to them. They're a great company for a classic outpatient clinic. I had this guy that has lived rent-free in my brain who was working on cars and heavy machinery every day, and he came in for double wrist pathology. He had essentially tendinitis of both wrists and had a ton of pain, and I thought to myself, wow, okay, we're doing the classics first, right? You are in acute pain, so we're doing the little low-level stuff first, but if I didn't ramp him up to heavier weights, heavier load to the muscles, he wouldn't have been ready to go back to lifting really heavy machinery, and the amount of load that is placed on his wrist throughout the entire day is really significant. If my rehab for him did not match that same level of intensity, he would have left maybe totally pain-free. I got him to the point where he was totally pain-free, but were the actual tissues of his wrists adapted enough back to the amount of load that he needs to withstand in his everyday life? That is the difference. I started that mechanic with tiny little wrist curls with like a 3-pound weight because he had pain with any more weight added. That was his early stage rehab. We worked him all the way up to doing 25-pound bicep curls, slow on the way up and slow control lower on the way down. We had him on machines moving 50 to 70 pounds for lat pull downs to make sure his back was really engaged and make sure that we had proximal strength and support to support the distal wrist pain. That was his end stage rehab, right? But Joe Schmo may consider his end stage physical therapy rehab to be strength training for every day. It's all about where you are at right now, what capacity your tissues have. We find that threshold and we build upon it. It makes total sense that physical therapy is associated with the resistance bands. And dare I say, a lot of people think that, physical therapists are just gonna give you a massage and send you on your way. I am so sorry to say that that is almost never the case, unless you are just absolutely at your wit's end one day and you just need manual and emotional support. Listen, there's always a time and a place, but 99.99999% of the time, I am never, ever, ever going to massage you, heat pack you, and send you on your way, because that is not the high quality care that I want to give out. Total sense though, I hearken to the founding mothers of physical therapy. This profession was founded by women who stepped up to help with military aid. These people stepped up. They were originally called rehabilitation aides, and they were working with people who were severely injured on the battlefield. And so it makes sense that at its origin, physical therapists are working with people who are so acutely unstable and unwell that they need the things that are really, really slow, low, and therapeutic in order to build them back up to their baseline. Whereas today, you can come in to a physical therapist office, or you can go to the hospital and have acute physical therapy if you are, yes, severely injured and unwell. My girl Kate, shout out to Dr. Kate, who is one of my dearest friends, is working at Beth Israel, and she works with people who have an ECMO, for example. If you don't know what an ECMO is, it is essentially a heart outside of your body. It is a machine that is helping pump your blood through your body externally, and she can get somebody up out of bed and mobilize them whilst on an ECMO. I mean, that's freaking amazing. She's monitoring their vital signs and making sure that they're being oxygenated and making sure that they are just getting to the point where they feel medically stable. She is doing the stuff that you might consider lower level, but that is vital, and her skills are so tuned in to this person at the point where they are at. Versus somebody who has back pain from having done deadlifts, and they come into me and maybe the specific deadlift under 150 pounds is painful, but I can still give them 50 in each hand to do farmer's carries, and that is going to be therapeutic for them at that point. All this to say, you might start out. I might start you with resistance band stuff, or even no resistance bands. We might be doing isometric exercises, which means squeezing your muscles without actually moving them, just squeezing them to get back in touch with them, relaxing and repeating. I'm going to figure out through questions about your life, through tests and measures, what your capacity is right now. I am then going to, again, through testing and guided exercise in a really supported step-by-step manner, I am going to figure out where your pain or your acute flare-up threshold is, and I'm going to keep you there and find exercises and find treatments that honor where your body is at right now and help you slowly move the needle forward. That is the whole thing. That is my favorite, other than emotionally supporting people and obviously taking pain away, which is the most magical thing in the whole wide world, which I don't really do. I give you the tools to do it and you help me do it. Other than that, my favorite part about my job is being a puzzle solver, a private detective, and figuring out for every single individual where that threshold is for you and helping you, holding your hand along the journey, knowing that healing isn't linear, knowing that realistically I'm probably not going to perfectly keep you under that threshold. We'll have little flare-ups. I'm going to give you the self-management tools to recover and come back down, but overall, you might have some bumps in the road. Overall, our trajectory is going to be up for you. That is always the goal. But I think this, again, speaks to what is the difference between rehab and training. There's not really an inherent difference. It just totally depends on where you are at and what you need. It's all on a spectrum of the isometric contraction, the light resistance band work, then the heavier external resistance with dumbbells or kettlebells or barbells or whatever it is, all the way up to the point where you feel really well trained and you are working at your absolute maximal capacity. It's all on the same spectrum. One exercise could be appropriate to stimulate the muscles enough for growth for person A, but for person B, who's been lifting for 15 years consistently, that same exercise is not strength training for them because it's not enough load to the muscle in order to stimulate growth. I'll give you one more example to put this into perspective, because recently I had a young woman come into me, one of my clients, and she was saying that she saw a fitness influencer online doing these exercises, and she was like, that's not strength training, Meg, right? Like, can you confirm for me? She was saying that, grow your glutes under this booty band, whatever. She's like, that doesn't look like strength training. That's not what we're doing in here. And I kind of explained the same thing to her, that yes, the dangers of social media are that, you don't always know all the nuance. That person isn't able to see you individually and assess you. So you got to take it with a grain of salt. But it got into it made me think of the Pilates debate. And I will speak about this in the future at length a little bit more, but I wanted to throw out the Pilates example too, because I think it's important to understand that those types of exercises she was showing me were a little bit more, Pilates princess social media type stuff. And I think Pilates gets really demonized. It is amazing for a number of reasons, which again, I'll go over in the future. But the thing really is, if your Pilates instructor is giving you exercises, or I know that there's, what are they called? Chains, bands. What the are they called? When you link on the blue versus the red in the Pilates reformer classes, they're like, oh, put on another blue and a red. You know what I'm saying? Those things. It's like, oh, springs. The springs. Okay, thank you. If your Pilates instructor in your class is giving you exercises that challenge you enough, or I know that there are different springs you can kind of hook on to increase your resistance in a reformer class specifically. Oh, you can add another spring to add resistance. There are ways to up the ante. You can ask the instructor, oh, how can I make this a little harder? Usually a great instructor will give you a hierarchy in terms of different options. Pilates is not inherently not enough for muscle growth and strength training maintenance. It is all about the specific class, the specific exercises, and whether those exercises are hard enough for you to the point where you get to near muscle failure, meaning that muscle is kind of feeling like jelly. You couldn't do another rep with great form, or you couldn't do more than 3 reps with good form within about 60 seconds. There's some, again, nuance to that, but it's all about whether or not those specific exercises were enough to stimulate muscle growth for you. If you have never done any sort of muscle activation exercise in your life, Pilates will absolutely help you gain muscle. You can consider it strength training. But if you're an individual who has years under your belt of heavy strength training, heavy loads to all your muscles, and you go into a Pilates class that's more being taught in a rejuvenating sort of slow flow way, then it probably won't be enough to maintain or gain muscle mass for you. It is all about you and your tissue capacity. That's it. Simple as. But I think you get the point. It is all about your baseline. And I think that a lot of what people struggle with in daily life outside of physical therapy is they might have a routine that they think is their foundation, and even putting acute PT aside, even putting injury or whatever aside, you will be different on any given day. Maybe you had an absolutely shit night of sleep. You will be different. Your tissues will feel different. Your nervous system will feel different. You will have a different level of reactivity. You are different on any given day, and you have to be willing to make those slight micro adjustments in order to keep yourself safe and ultimately keep the needle moving forward for you. Because if your PR is 400 pounds on the leg press, but you didn't get enough sleep and you didn't nourish yourself or hydrate yourself yesterday well enough, and you had a fight with a really, dear loved one, and you're just all out of sorts, that 400 pounds might feel impossible. It's not necessarily that you lost the muscle strength and you've gone backwards. It's that day, your nervous system may not be convinced that you are safe. You might feel really fatigued and burnt out, and it would benefit you to go lighter in that moment, or maybe you do an extra long warm-up, or maybe you say, gosh, I really need to fuel more beforehand. Maybe I work my way up a little bit slower, and then I get there today, or if I don't, that is okay. I'm going to take care of myself. I'm going to give it a couple of days. I'm going to come back. And now I can do my PR weight or even more with no problem. My goal, my end goal for people is to make you feel really independent with self-management, yes, of injury and preventing future injury and preventing flare-up and just feeling fabulous, but also to help you adapt to the natural variation of everyday life and the phases of life where your nervous system, your body will feel under more duress than other times. These transient, hopefully transient phases for you where you're feeling like you're more on the struggle bus. And same thing as rehab versus strength training. You just got to figure out, where's my threshold today? Don't panic. That's a huge key. Don't panic about the threshold. Don't give myself all this judgment. Own it. Listen to the body. Use the tools I have in my toolbox and move forward. Injury happens when the force to your body, usually a tendon of your muscle, injury happens when the force exceeds your capacity. We are always trying to keep you within your threshold and capacity and slowly, incrementally, intentionally building you up. It's all relative. And something that I also think is important to say that is hard for people to hear is that when you're thinking about that spectrum that we've described, rehab all the way to day-to-day strength training, you think about progressing along that spectrum. What some people unfortunately expect is that, okay, I'm in rehab land right now. I'm working my way up back to a normal baseline of strength training or going through my daily routine, and now I'm good. And now I can just cruise on this base routine for the rest of my life. And it may be true that you could have the same exercises, the same movements for the rest of your life, but if you don't continue to challenge yourself, you will stagnate and you will have negative health repercussions as a result. I never like to speak in definitive statements because there's so much gray, there's so much nuance, but this statement is true. If you do not combat the natural loss of muscle mass that happens as we age, you will get into that fragility bucket. Eventually it's inevitable that your bone density will be impacted, your metabolism will be impacted if you are not maintaining or gaining slowly muscle mass through the rest of your life. And so I think about that day one tiny little wrist curl or resistance band work, whatever it is, working all the way up to the 25-pound bicep curl. If you can do a 25-pound bicep curl, you're killing it. You are absolutely killing it. However, you could not do that same exact 25-pound bicep curl, no matter how badass it is, for the rest of your life and expect to maintain muscle mass in your bicep. You might be genetically blessed. There might be other factors. Maybe unknowingly you are, moving through more range or you're engaging more. But generally speaking, if that was where your capacity is at one point, your muscle tissue, if you're consistent, will continue to adapt, and it'll get to the point where that 25-pound bicep curl is easy peasy for you, which means it's time to go up. You have to go up in weight. You have to go up in range of motion, or, there's a million ways to slice this pie, but you got to keep moving forward in order to, again, maintain at the very minimum. And you kind of got to be in building mode because it's an exponential loss of muscle. So annoying. You got to keep going or else you'll stagnate. And so what I do for a lot of folks that I think is very unfortunately different, and I have no judgment because PTs in high volume outpatient clinics are grinding. They have to work hard to leave work at home when they go home to be mentally well and to not be burnt out. There's a lot of pressure to see a lot of folks, and a lot of times it can feel like the mill experience for people. Again, despite the best of physical therapists out there, it's a really hard environment. Healthcare is just, really stressful, and there are a lot of issues in that regard. So no judgment for a lot of amazing PTs, but I think something I do differently that is a bit life-changing for my patients is when I'm discharging you from physical therapy, when you are graduating from your course of PT and you feel awesome and you feel ready to hit the ground running in your life again, I am not just handing you a packet of the 35 classic exercises that you were doing with me during your early stage rehab and saying, here you go, have a good life. A lot of people get the packet, the dreaded little one frame of the exercise packet in black and white print that was shoved at them as they're going out the door because there's 3 more patients coming in. They get that packet, and typically, I've had some stars who are like, I live and die by this packet, and good for you. You know who you are, homies. I love that about you. But the vast majority of us get this packet, and they say, what does this mean? I have to do this for the rest of my life? Like, I'm just under the impression that I either have to do this for the rest of my life, or I'm never going to do it again, and I'm just going to get injured the same exact way, or the pain's going to return, and I'm back to square one. I saw people for the same stuff. When I was such a young little PT first working, I did not have the time, emotional bandwidth, or the knowledge of how to give people the highest yield stuff, how to give people the self-management education to continue to progress at home. I either didn't have the time and a little bit of didn't really appreciate the know-how and this huge gap in the industry. I've come so far since then, and I'm happy to be at this point where I can really get real with folks and say, you're not gonna get the packet of the exercises you had with the bands that mean nothing to you, that are gonna keep you feeling like you're doing your PT stuff. I might leave you with some of the most high yield of those things as little tools for your toolbox. Let's say if you flared up, or that you can add to your routine as recovery or injury prevention. Maybe you use some of those rehab early PT stuff in your warm-up or in your cool down, or you do them on an active recovery day. That's all fine and dandy. But I'm gonna get real with you about, what does your life entail? I've learned what your daily activities are. I've seen what your fitness level is right now. Let's make sure that you have a routine that you can do for the rest of your life to keep you successful and keep that needle moving forward. Let's make sure you have the education points to know when an exercise is appropriately challenging you right now and when you have to up the ante. Give you these options, give you the self-management tools so that you can move forward and you can say, oh, I'm done with my physical therapy exercises, and now I have the know-how, I have the tools to move forward and do one day of a full body strength training routine, and do my spin class and do my yoga class. And I've been taught to know when I need to kind of push forward a little bit or when I need to pull back. And I can just sail off into the sunset doing the things I actually want to do, versus the person who is given the packet with no education and no guidance, and they never pick it up again, and they're not sure what other exercises, what classes, whatever may be safe for them or what would be appropriate for them, and they just decide to do nothing, or maybe they accidentally do too much and they get injured again, and they either come back to see you for the same darn thing, or even more tragically, which is tragically common, they say to themselves, well, I gave it a good try. Maybe my PT was nice, but actually physical therapy doesn't work for me. It makes me want to cry. So many people say to me, yeah, I tried physical therapy for my knee thing 10 years ago, and yeah, it didn't really work for me. And it's probably not that the physical therapy didn't work. It's probably that they either, yes, sometimes you have to take the onus on the individual. They either did not put their big girl pants on and step up to the plate and make sure they were prioritizing their health moving forward. That's absolutely possible. Or that PT unknowingly, unintentionally failed to give them the self-management tools and education that they needed to really be successful in life moving forward. And now that you understand, if you're picking up what I'm putting down, that it's all relative, and that you can really look at that rehab and that strength training just on a beautiful spectrum. My old lady in the bed just raising her arm overhead can be strength training, and also my baddie in the gym lifting 1,000,000 pounds on a deadlift is strength training. And depending on where you are at in your life, we're gonna pinpoint you on that spectrum and always try to move you forward. No matter where you are on any given day, you might be at a different point. Now, if you're understanding that, I would like to go into my next piece of this podcast, which is really appreciating when it might be appropriate to see a physical therapist. You understand now that I can take you through that progression from acute rehab to a strength training baddie, but when in general might it be appropriate for a PT? What can we do to serve you? What populations can we help? And again, this is such a vast field. There are folks who see all different kinds of conditions and folks with all different stuff going on. But focusing on a classic outpatient environment, you could be, of course, in the category that I think a lot of people think of. Okay, you go to a physical therapist when you're injured. Would you come see me immediately if your bone was sticking out of your body? No. You would go to the hospital first. There's the category of medical instability, or even outside of medical instability, if you just have a really, really well-built trust with your primary care physician, awesome. But in general, if you've got pain, strains, itises, all those things, you're in the bucket of, yeah, I'm acutely injured. Something has happened to me. I know that I am stable enough. I am not medically unstable such that I need to go to the emergency room, or that I am so deathly afraid that I really need to check with my primary care physician first to see if I'm even cleared for exercise. Like, there are those really severe, worrisome buckets. But if you have the classic acute injury where you know that you are stable, physical therapists can be first line. There's a huge debate. I will say there are tons of circumstances where you would probably have been better off coming directly to a physical therapist instead of going to your PCP first. I think there needs to be continuous trust built in this profession for folks to entrust us as the professionals that we are to have your back, and to know that the research is very loudly saying that in many cases it is better for you at the end of the day. You'll have better outcomes coming to us first. I'll explain that a little bit more, but generally, super lightly, very, very emergent acute injury, go to the hospital, your bone's sticking out, make sure you are medically stable. Then you have the bucket of, you know what, I'm just so nervous about everything and I am really down and out and I really want the assurance from my PCP. But then you have the category where, regardless of your relationship with your primary care physician, you know that, okay, physical therapy is probably what I'm going to be recommended. I want you to know, this is a huge deal, that we have direct access in the state of Massachusetts. And in fact, in all 50 states, we have some level of direct access, which means you can come directly to me without needing to go to your PCP's office first or call up and get a referral. You can come directly to me. Low back pain, for example. People love to argue about this online. I was reading some comment threads the other day and did not have the energy or stamina to reply at the time, but there was this hot debate. There was a little quick TikTok about, on one side it was go see your PCP, and on the other side it was go directly to your physical therapist, and in the middle would be a condition or an issue going on, and the person would jump to one side or the other to indicate which side you should go to. And a lot of people really came down on them for saying, this is rage bait, this is clickbait. Like, I'm so frustrated that you said PT for certain things that you absolutely should go to your PCP for. That would be so dangerous. If you have back pain, well, what if there's underlying issues? What if you actually have cancer? What if you actually have, you're about to have an abdominal hemorrhage? Like, what if all these things are happening? Your blood pressure sky high, you have a headache, and you go to your physical therapist, but you're actually about to have a stroke. Like, how irresponsible of you. And it's awful because, again, at the end of the day, whatever is most comfortable for you, if it's safe and grounding for you to go see your PCP first, I commend you to do that. But I also want to educate you that when you are medically stable, and even if we call them red flags, not the red flags of like the dating scene, but red flags in terms of big ticket medical dangers, we are trained to differentiate and give that differential diagnosis. We are trained clinical professionals that will be able to have somebody sitting down with us in our clinic, hearing all the information about what's going on with you, and we will be able to really, really accurately, according to the research, it is there, I'll link some below. According to the research, we are, as a profession, extremely well equipped to differentiate, Are you appropriate for physical therapy and you'll be safe to move forward? Or is something underlying that I'm worried about and actually you're not appropriate for PT right now, and I'll be able to tell you whether you go back to your PCP or you check up with a specific specialist or you go to the hospital or what have you. We as a profession, we're trained. I will never forget her. I have an amazing mentor who has since passed away of cancer. She was an amazing, resilient woman, Dr. Mary Hickey. Makes me emotional. This is my first shout out to her, I think, and I'll certainly be talking about her in the future. She was the professor for our differential diagnosis class, our screening and red flags class, where she went over all of the different symptoms that can mimic back pain, for example, and all these different conditions. And she taught us how to be able to tell when somebody is appropriate or not appropriate for physical therapy. The research is showing that on average, let's keep using back pain as an example. If you have acute back pain and you go directly to a physical therapist, you are going to get better outcomes than if you waited. Usually it takes a long time to get an appointment with your primary care physician. You waited a longer period of time to go see them first, to then sit in a room where they don't have much time to spend with you because of the woes of the healthcare system. Then you might get something that was a little more lackluster in terms of they're sending you to another specialist, but they're not giving you maybe the assurance and education that you want because they don't have too much time to chat with you. It's a hectic environment, but okay, now you're going to a specialist first, maybe a neuro specialist or a cardiac specialist or whatever specialist to rule some stuff out. They end up ruling it out, and then finally they say, okay, well, now that we've ruled this stuff out, now go see a physical therapist. And you're finally sitting on my bed with me in absolute dismay, being so tired and broken down from all the time that it took to get you here, when you could have just walked in on day one. I could keep you safe and make sure that there's nothing underlying going on, and then I could help you get rid of that back pain in a much more efficient manner. At the end of the day, medical professionals are human beings. Are there circumstances where human beings make mistakes and don't catch things? Absolutely. And that's super scary and really reasonable. But the science is there for a reason. The research is extremely loud. So all of that rambling to say, I really commend you to try. Maybe you do both simultaneously, but try to go into a physical therapist first, one that you trust, one that's going to have the time and give you the attention that you need. Outside of those folks, then you're moving forward to the sort of chronic pain folks where you might not consider yourself injured, but you have something lingering, you have a neck knot that just has not gone away for forever, and maybe you tried to sweep it under the rug and you tried to move forward with your life. It's not impeding you from getting your activities done, but it is really significantly impacting your quality of life. Maybe it's screwing with your sleep, maybe it's screwing with your emotional well-being, and it's something that you really should address. You have those folks who are ripe, who are perfect for physical therapy. We will take care of you. Me, myself in particular, I specialize in chronic pain and pain science because chronic pain is a totally different beast than acute pain. And I find that, the education piece and the self-management piece is huge for that population. That is extremely ripe for physical therapy. Then you're moving forward even outside of this, right? Maybe we go all the way over here and you're a person on this big spectrum of injury to non-injury. You're a person who doesn't really have pain. Maybe you feel like you have a pretty good handle on your fitness routine, but there's just something missing there. You're not seeing the results you want to see. Maybe you feel like you're unsure whether you're safeguarding yourself against future injury. Maybe you've had injury and stuff in the past. You're keeping it at bay for now, but you are starting a new job or you are going into another phase of your life. For whatever reason, maybe you are not getting the results you want, or you are fearful that whatever is coming up in your life is going to impede your results, or you're fearful that, you've had injury and stuff in the past and you want to avoid a flare-up. You've avoided it for now, but you're getting older. There's a million different reasons, right? You're in the non-injured bucket, but there's something to be desired. And a lot of people just, don't have the time and energy. They're not prioritizing that part of their health. There's already enough. Life is so busy. There's already enough to worry about, right? And I totally, totally understand that. But I want to advocate for physical therapy as a means of helping with prevention. Fitness in general, and I am a physical therapist and fitness professional, fitness in general should be, sometimes it's not because it's not dosed appropriately, but fitness should be healthcare in the form of precious prevention. Rehab, if you've ever heard that word, shout out to the Rehab guys. They're an amazing follow on social media, amazing physical therapists. Rehab means preventative, using the rehab principles to do things that are more in that training bucket, but doing them with the intent of safeguarding you and preventing injury, making sure that you are functioning at your very best and feeling your best in all aspects of health to keep you safeguarded for the long haul. I'm going to advocate hard for physical therapy as a form of prevention. It's particularly appropriate for folks to maybe start a formal course of physical therapy if they have something in their past that they're worried about or a very specific goal that they really need that healthcare guided touch with. But in my business model, I have services for you that run this gamut. So you don't have to go and undergo a specific course of physical therapy, but you can work with me, a physical therapist with the knowledge of a medical professional in a fitness capacity. I have services that are fitness consultation services where theoretically you could just come in and ask me anything you need to know in the realm of fitness and training and keeping yourself healthy and well. But I also very often make people custom programs where I am giving you the exact exercises, the exact warm-ups and cool-downs, the exact education that I think will be best for you in terms of building your week overall, giving you the recovery tools that you need. I run the entire gamut from acute rehab, physical therapy, all the way up to I want some better results or I want to make sure I'm doing the right stuff for me that's going to keep me healthy and well for the rest of my life. All of these people theoretically are appropriate for physical therapy, with those folks at the end here being also appropriate for fitness services by a physical therapist. And if you're ever curious, if you're ever concerned whether or not what you've got going on is appropriate for physical therapy, you can always ask a trusted professional. You can reach out to me at lovelybonespt.com. I have free consult calls where I get on the phone with you, and because I have not individually assessed you, it's not going to be individualized medical advice, but I'm going to give you the best general advice I can give you based on what you tell me, and I'm going to try to point you in the right direction, whether it's services with me or whether it's services outside of me or what have you. I offer that free service for people 30 minutes or less because I really want to make health education accessible. I really want to help you if you are at the point where you just need some support and you don't know what might be best and you don't know where to go. Realistically as well, you might be a person, and I have to live in the reality of this world, right? I of course want everybody to have no issues and no barriers with getting this care. But finances, of course, are a significant factor to consider. So if you are a person where ideally you would be undergoing physical therapy and you either don't have the insurance benefits to go elsewhere or you don't have the means to go work with me where I'm private pay, I am going to give you free education and resources. I have a million little recovery classes on my YouTube channel, for example, and little free resources that I am aware of that might help you right now move the needle forward for yourself in the absence of, as a replacement for now, of what might be ideal but is not doable for you for whatever given reason. I have something to give you, whether it's again with me or outside of me. I want to help you. I want to help everybody make sure that they feel their best. Life is hard enough and there's so many struggles out there. And very often, again, I think I said this in a former podcast almost exactly, but very often people are not prioritizing their health until they get to a point of crisis. And I want to help empower you to, yes, of course, help you rehab from acute injury, but ideally help you safeguard yourself before the crisis point hits. keep you under that threshold of burnout, under that threshold of injury, without you needing to experience the whole cycle of getting to that point, cycling through stress, fear, pain, and going around and around. Thank you, as always, for supporting Lovely Bones in any way, shape, or form. If you are here, I am so incredibly honored to have you. You matter, and you are amazing, and you deserve to feel well. Shout out to Brock Lefferts for my amazing podcast music. Check him out in the show notes. Happy March, happy spring. We're gonna kill it. I think a lot of people this time of year are already disillusioned with their New Year's resolutions, and they feel like they've been going through the cycle of trying to do something to help themselves and feeling like they're a failure and spinning around in this cycle. And I am trying to just empower you the whole year through. There's every day, every moment is another time to do something positive for your health and make sure that you feel well, and you can always build on that. Take the pressure off yourself. You are killing it. Reach out to me if you need me. Visit lovelybonespt.com to check out all the services I offer that I mentioned. Run the gamut, particularly those free consult calls if you just need a little listening ear and you need a little right direction. Whether you work with me or not, see someone you trust. Entrust in a health or fitness professional that's going to help you move the needle forward, because you just so deserve to be well. Again, thank you for being here, and have a beautiful rest of your day.